Patient preparation. Goals of patient preparation are that we need to explain to the patient what the ordered therapy is going to entail so they know what to expect. IV therapy minimizes the risk for complications, and we need to minimize patient anxiety. The results of preparation should be patient cooperation, their participation in their care, and alleviation of anxiety. The process of preparation includes assessing. So what stage of illness are they in, and what is the need for therapy? What type of therapy is required? Planning. We need to know about teaching. So what do we need to teach? What is the purpose of the therapy that has been ordered? What is the method of administration, and how long might they be on this type of therapy? What are the limitations or restrictions that will be placed on them because of this therapy, such as positioning of the extremity, and you have to maintain dryness to the site, and don't play with the equipment. Guidelines for trouble-free ambulation, and notifying the care provider if they have discomfort during the treatment. So they need to know all of this stuff, but it needs to be appropriate to the therapy they are receiving. They also need to be reassured that they will be monitored during therapy, and they need to have feedback. A patient's personal psychological resources are based on their age, their pre-morbid personality, their family relationships, the presence of other concerns, previous experience with illness or pain, and a relationship that they have with members of the healthcare team. So it's really important to understand that some patients will really stress out when they are told that they're going to receive IV therapy. So you need to understand the signs and symptoms of stress on the patient. And you also need to understand approaches for providing appropriate emotional support for the patient receiving IV therapy. With the uncooperative or confused patient, they can exhibit uncooperativeness through verbal abusiveness, physical assault of the care provider, removing a cannula that has already been placed, altering the flow rate, or disrupting the delivery of the therapy itself. Non-cooperation, we might see their reaction to stress, alteration in a mental status. They might be mentally impaired. They may have atherosclerotic cerebrovascular disease, delirium or dementia. They may have drug-induced mental incapacities, or there might be other underlying diseases, hearing impairment or language barriers. So nursing considerations would be that you would closely monitor the patient, make certain that you use discrimination in the selection of the IV site, assess possible alternative routes of drug administration, use behavior modifying medications if necessary, but as a last resort. Use safety mittens when indicated. And do realize that mittens are not considered to be a restraint.